My name is Anne-Sophie. I work at the Hospital Clínic of Barcelona and the Institute for Global Health Research of Barcelona. We have been coordinating the H2020 project called Inspires, funded by the European Commission for the past 4 years. It might sound a bit weird in the first place, as it is a more common practice in countries such as, for example, the Netherlands, Denmark, France. But in Spain, there is still not much culture of collaborative work between civil society and scientists. So we have dedicated our efforts over the past 4 years to implement the concept of Science Shop. The concept of Science Shop was born in the Netherlands in the 70s, during which partnerships between university members, student movement activists, and civil society organizations were forged, reflecting their interest in joining forces to examine specific research questions, above all in the environmental field, but also in feminism, nuclear resistance, minority, and the workplace. There are many different types of Science Shop, but what they all have in common is that they all operate following a bottom-up approach, and they retain the same internal processes. Their work typically begins by entering into a dialogue with civil society organization members to identify their needs. Appropriate research questions are then formulated through a co-creation process, together with all the actors. Well, a science shop is useful for many reasons. First of all, it brings closer different actors that are not used to work together. The citizens, the scientists, but also the students, and other key actors such as public authorities and industries when needed. It therefore forges new networks and partnerships. It responds to civil society needs and concerns, creating new knowledge with great potential for transformative change. It contributes to the training of the next generation. Students acquire new competencies, skills and attitudes that they will not have gained in a more classical bachelor, master or PhD type of work. It gives new ideas to researchers, help them to understand the many different realities of the people affected by a specific problem or disease. It opens up the institution in which the Science Shop operates and gives them an active role in their communities. Finally, it reinforces democratic values and practices, inviting many different actors around the table during important decision-making processes. The first advice we would give is to start small and with great motivation. Choose an association and a team with who you share the same values of trust and openness, and therefore where you can establish a good relationship and work atmosphere. The research process does not have to be open at each phase of the process, but co-create the research question together with civil society and give them back the research results through a public event or a report using plain language, for example, is already a big thing. So those 2 steps already mark the beginning of a huge cultural change. Good luck!